May is Lyme Disease Awareness Month, and researchers say ticks carrying Lyme are established in nearly all parts of the state except for Aroostook County.
This tick migration means more people are at risk for the disease and other co-infections. MaineHealth researchers are currently recruiting patients with early-stage Lyme for a groundbreaking study.
As News Center Maine's Vivian Lee reports, the aim is to find out why some patients don't fully recover from the disease despite early treatment.
Chuck Lobelchuk is the vector ecologist for the MaineHealth Institute for Research. For years, he and his team have dragged for ticks in every county in Maine. The ticks are brought back to the lab for study. Lobelchuk explains that due to warming winters, which allows ticks to thrive, it won't be long before deer ticks are found in every corner of the state.
Somerset County, we were able to watch the ticks first show up there about 8 years ago and then just gradually increase. And last year, they took off. So I think that's what we are going to see probably in Aroostook County as well.
The Maine CDC has reported 581 cases of Lyme disease so far this year. However, ticks are not only expanding their range, they are also carrying a variety of pathogens that can cause anaplasmosis and babesiosis. Both diseases can lead to flu-like symptoms, and severe illness is particularly concerning for the elderly and those with weakened immune systems. Cases are on the rise in Maine. Additionally, cases of the Powassan virus, which was once considered extremely rare, are becoming more common. This virus, carried by deer ticks, can be fatal and may lead to long-term neurological issues. Last year, there were 5 reported cases in Maine, including the death of an 81-year-old man from York County. This summer, MHIR research scientist Rebecca Roebuck and her team will be setting traps to collect and study ticks on shrews and voles to determine if the animals are contributing to the spread of the virus.
With those positives that we find, we're trying to figure out where it got it from in nature. Where did it pick it up from?
MaineHealth providers are also recruiting patients for a 5-year study focused on people who continue to experience lingering symptoms of Lyme despite having received early treatment with antibiotics. Studies show that 10% of patients with early Lyme still don't feel well after treatment.
Look at it from all aspects, from the immune system, from genetics, from type of bacterial infection they had. All of these things will go into the analysis to try to understand better what's going on so that we can come up with new approaches to treatment.
Chuck and his team, meanwhile, are also monitoring the Lone Star tick, which can cause an allergy to red meat. However, the species is not yet established in Maine. In Scarborough, Vivian Lee, News Center, Maine.